Are you pregnant and wondering how to stay strong, confident, and prepared for the incredible journey ahead? Imagine a simple daily practice that not only strengthens your body but also empowers you from within, helping you feel more in control during labor and recovery. In this video, we're diving deep into pelvic floor strengthening exercises for pregnant women, including Kegels, both basic and advanced techniques that you can start today. No equipment needed. You'll discover how tiny, intentional contractions can make a huge difference in your posture, core stability, and overall pelvic health, while also boosting your confidence and connection with your body. Whether you're a first-time mom or adding another little one to your family, these exercises are essential for preparing your body for the challenges and joys of pregnancy and beyond. Stay with us and learn how just a few minutes a day can transform the way you move, feel, and embrace this amazing chapter of your life. Pregnancy is often described as a journey of transformation, both physically and emotionally, a period during which a woman's body adapts to the miraculous task of nurturing new life. Among the many changes that occur during these months, one of the most critical but often overlooked areas is the pelvic floor. The pelvic floor, a group of muscles, ligaments, and connective tissues that support the bladder, uterus, and rectum, plays an essential role in maintaining not only continence but also core stability and overall pelvic health. Strengthening these muscles during pregnancy is more than a preventative measure. It is a foundation for a smoother labor and a faster postpartum recovery. For many pregnant women, pelvic floor strengthening exercises become an empowering daily ritual. A few minutes carved out to reconnect with the body in a gentle yet profoundly transformative way. Among the most renowned and widely recommended exercises for this purpose are Kegels pelvic contractions, which come in both basic and advanced forms. The beauty of Kegels lies in their simplicity. With no equipment required and the ability to perform them almost anywhere, they provide an accessible entry point into pelvic wellness. The basic Kegel, often introduced in the early stages of pregnancy, involves identifying the correct muscles, the same muscles one would use to stop the flow of urine, and performing controlled contractions followed by complete relaxation. Many women initially struggle to isolate these muscles, discovering instead that surrounding muscles, such as the abdomen or glutes, tense up in their place. However, with patient practice, the mind-muscle connection becomes increasingly intuitive, and the benefits, subtle at first, gradually manifest. Basic Kegels improve blood flow to the pelvic region, enhance muscle tone, and reduce the risk of incontinence both during and after pregnancy, while also fostering a heightened awareness of one's own body. As pregnancy progresses, the demands on the pelvic floor intensify. The growing weight of the uterus, shifts in posture, and the hormonal effects of relaxin, a hormone that softens ligaments and joints, combine to make the pelvic floor more susceptible to strain and fatigue. This is where advanced Kegels come into play. Advanced variations often involve longer holds, increased repetitions, or the integration of the breath to deepen the contraction and improve endurance. For instance, some advanced techniques encourage a gradual lift and squeeze, where the pelvic floor is slowly drawn upward, while simultaneously engaging the deep abdominal muscles, holding for several seconds, and then releasing with intention. These exercises not only strengthen the pelvic muscles, but also train them to respond effectively under the pressures of labor and delivery, giving expectant mothers a sense of control over a process that can sometimes feel overwhelming. In addition to their physical benefits, pelvic floor exercises cultivate a mindful connection to the body that can ease the emotional challenges of pregnancy. Many women report that these exercises foster a sense of inner strength, a quiet empowerment that extends beyond the pelvic region. Practicing Kegels basic and advanced becomes a moment of stillness, an opportunity to focus inward, to acknowledge the body's resilience, and to nurture the life growing within. In a way, each contraction and release mirrors the rhythm of life itself, a subtle echo of the contractions that will eventually guide the baby into the world. Integrating pelvic floor strengthening exercises into a daily routine requires both consistency and creativity. Some women prefer to weave Kegels into mundane tasks, performing a few contractions while brushing teeth, waiting for a cup of water to boil, or sitting in traffic. Others create a dedicated mini routine, setting aside 10 minutes each morning or evening for a more deliberate practice that might include both basic and advanced exercises. The key is intentionality, approaching each contraction with focus and awareness rather than rushing through repetitions. Over time, these small daily acts accumulate, building not just muscle strength but also confidence, preparing the body for the profound challenges and joys of childbirth. It is also important to remember that not all pregnancies are the same, and pelvic floor health can vary widely among women. Consulting a qualified healthcare provider or pelvic floor physical therapist can provide personalized guidance, ensuring that exercises are performed safely and effectively. They can introduce modifications for common pregnancy-related issues, such as diastasis, recti, lower back pain, or pelvic organ prolapse, and help develop a progression from basic to advanced Kegels tailored to the individual's needs. The journey of pelvic floor strengthening is thus both personal and adaptable, reflecting the unique contours of each woman's body and experience. Interestingly, the benefits of these exercises extend beyond the immediate context of pregnancy. Women who maintain a regular routine of pelvic floor exercises often notice improved posture, reduced lower back discomfort, and enhanced core stability. In addition, after birth, the ability to engage these muscles consciously can aid in recovery, reduce the risk of urinary incontinence, and even enhance sexual health and satisfaction. Thus, investing time in Kegels pelvic contractions, whether basic or advanced, is not simply a short-term solution, but a lifelong gift of strength and awareness. The journey through pregnancy, with all its physical and emotional shifts, can sometimes feel overwhelming, but incorporating pelvic floor strengthening exercises offers a tangible way to reclaim agency over the body. Each basic Kegel provides a foundation, a gentle entry into the awareness of a hidden, powerful network of muscles, while advanced variations challenge endurance and control, preparing the body for labor's intensity. Beyond the muscles themselves, this practice fosters a deeper connection to the self, a daily reminder that the body is capable of both extraordinary resilience and subtle grace. Finally, it is essential to approach these exercises with patience and self-compassion. Progress may be gradual, and consistency matters more than intensity. Even a few minutes a day of dedicated practice can yield noticeable improvements over time, supporting both the physical demands of pregnancy and the emotional journey that accompanies it. By embracing pelvic floor strengthening exercises for pregnant women as both a physical regimen and a mindful practice, expectant mothers not only fortify their bodies, but also cultivate a sense of inner calm, awareness, and empowerment to preparation that serves them well before, during, and long after birth. In conclusion, the act of performing Kegels, in their basic and advanced forms, is more than a mere exercise. It is an intimate dialogue between a woman and her body, a practice that nurtures strength, resilience, and connection. Pregnancy is a transformative period, and dedicating time to the pelvic floor is a profound way to honor that transformation, ensuring that the body is prepared for the demands of labor, recovery, and the new rhythms of life that follow, with commitment, guidance, and mindfulness. These exercises empower women to meet the challenges of pregnancy with confidence, grace, and a deepened appreciation for the extraordinary capabilities of their bodies.